Now, measles, it's the childhood virus that is almost entirely preventable, but now the once dormant disease is on the rise. It's spread fuelled by falling vaccination rates. So just how bad could it get?
In 2014, the WHO declared it eliminated from Australia. Now, the deadly disease is making a comeback.
Measles is no joke. All the potential complications, things we don't want to see and things we don't need to see.
Across Australia, 29 cases of the measles have been reported already this year, compared to 57 for the whole of 2024 and just 26 in 2023. The virus brought into Australia by travellers returning from Southeast Asia.
If the current trajectory so far this year continues, we'll probably see double the number of cases that we saw last year.
Last year, Europe recorded the highest number of measles cases in nearly 3 decades. And in the US, a measles outbreak across multiple states is surging. Ground zero, Texas, where last month measles killed an unvaccinated 6-year-old child.
The reason it's happening is because we have a large unvaccinated population in West Texas.
Vaccination, the best defence against the disease.
The vaccine's one of the safest, most effective vaccines we have. 2 doses is 97% protective.
But those vaccines are being undermined by the country's very own health secretary.
They're getting very, very good results from budesonide, which is a steroid, and clarithromycin, and also cod liver oil, which has high concentrations of vitamin A and vitamin D.
Like COVID, measles spreads through airborne droplets, and for the unvaccinated, the risks are real. In mild cases, measles can cause a rash and fever. In severe cases, it can lead to brain swelling, blindness, hearing loss, and pneumonia.
About 1 in 5 people can end up in hospital, about 1 in 1,000 can die.
Highly contagious, measles is more infectious than COVID, smallpox and Ebola, which means to prevent outbreaks, 95% of the population needs to be vaccinated. Right now, less than 91% of 2-year-olds in Australia are fully immunised.
Declining vaccination rates are in play here. Part of that is due to vaccine fatigue and suspicion over vaccines that developed through the pandemic period.
So as cases of measles mount, just how worried should we be?
Well, Margie Danchin is a professor of paediatrics and a vaccine expert at the Murdoch Children's Research Institute. Professor, just how worried should we be about this?
Look, as you said in the introduction, we've already seen 29 cases in Australia this year, which might not seem like much, but last year we saw 57 for the whole year, and in 2021 there was 0. And as you've highlighted, there's been a global increase in measles cases with, 300 cases in the US and a preventable death in a 6-year-old primary school child in America. I mean, this is extremely concerning. Parents are not familiar with the signs of measles. Many have never seen it. Many paediatricians and doctors have never seen measles. So we really need to alert the public and the community what to look out for, how nasty measles is. As you said in the introduction, or as Sanjay said, 1 in 5 people can be admitted to hospital, 1 in 20 can develop pneumonia, and 1 in 1,000 can get really severe brain swelling or encephalitis. So this is nasty. Parents need to know how to prevent it and what are the signs to look out for.
Professor, how quickly could something like this spread?
Well, unfortunately, in Australia, we've seen a progressive decline in our childhood vaccination coverage rate since 2020. At the moment, we give 2 doses of the measles, mumps, rubella vaccine at 12 months and 18 months, and we're only seeing coverage rates around the country between 90 and 91%. For the measles vaccine, we need at least 93 to 95% for that herd immunity threshold. And in some places around Australia, like the Northern Rivers region, the New South Wales hinterland, the measles vaccine coverage rate is around 70 to 75%. And we also know, very importantly, that in a completely unvaccinated population, 1 primary measles case can lead to 18 secondary cases. So this virus is a heat-seeking missile. It will spread rapidly in unvaccinated communities, and we need to get on to improving coverage.
The drop-off in those vaccination rates you mentioned, it's pretty alarming. Do we have a vaccine hesitancy issue that's growing?
I think everyone needs to be aware that the gap in under-vaccination is not just due to hesitancy or concerns. In fact, what we've shown with research that has been funded by the Commonwealth Government in partnership with Murdoch Children's Research Institute, University of Sydney and the National Centre for Immunisation Research and Surveillance is that the main barrier for partially vaccinated children, so these are unvaccinated kids, is practical barriers. So what do I mean by that? That means parents are struggling to be able to make an appointment with a GP. They can't afford the costs associated with vaccination, and they are not prioritising vaccination over other things. Now, that might be quite shocking to people in Australia. The vaccines are free, but there are really disadvantaged families and pockets where people cannot access vaccination. They might be working full-time, single families. We need to improve access to vaccination for families.
I have to admit, Margie, this is not a story I expected to be doing, but here we are. Thank you very much for your time.
Thanks very much.